All right, guys. So this is another live stream, and I'm just doing live streams right now or nowadays, because when I uh, when I just record videos, they don't get any views on YouTube for some reason. It's probably shadow blocking and stuff like that. But if I go live on YouTube, then I get I get like I do get some views at least, something like 20, 30, something like that, which is, for me, that's pretty good. If I upload a pre-recorded video, I get 0 views. So that's why I'm trying to break through the YouTube algorithm. Obviously, homeopathy is a suppressed subject. So that's why it's blocking me, or it knows something about me, which is not very nice, maybe. So I'm live on YouTube, I think. I'm live on Odyssey, hopefully. I'm not sure about Odyssey. Am I live on Odyssey? That is the question right now, which I'm asking myself. And I think I'm gonna check that right now. So I'm gonna start in 1 second, guys. I'm checking. I'm checking my Odyssey. 1 second, guys. I think I'm live on Odyssey. Yeah. Wow, Odyssey, Odyssey. You can't even. There's no comment monitoring in Odyssey. Does anyone know how a comment monitoring in Odyssey works? Because I can't, for if you're live, right? You do have to just look at your own watch page, your own channel page, or what? For if you're live, if right? Somebody knows about that, then just tell me. All right. Let's see here. I think I'm live on Odyssey. That is good. And live stream chat. Okay. How do you view the chat? All right. I got it, I think. All right. I think I got it. Okay. So this is a live stream where you can ask me anything, basically anything you want about homeopathy, about health in general. What's my opinion on different forms of alternative medicine? You saw Tom Cowan, and you're wondering if my opinion, if he's legit or not. You're wondering about my opinion, or you saw someone pushing Rudolf Steiner or whatever. How does that tie in with homeopathy? What is going on there? Or just anything. You can ask me anything, right? Remedies in homeopathy. What do I recommend for this or that? Feel free to ask me anything. This is an AMA, okay? And so while we wait for people to show up, which might not happen again, but it's still good. It's all good because I'm getting more views on YouTube, even without live viewers. I'm getting, people watching the recorded stuff. The number of people is going to be much higher. So while we wait for, just in case some people might show up, I'm going to be talking about remedies for heat stroke. So this is a timely topic in some parts of the world right now. It's getting real hot. And, if you have a homeopathic first aid kit at home, you can try to treat heat stroke. Of course, you have to go to the hospital. But like on your way to the hospital or something, you can try to treat it with homeopathy, right? So basically, here's heat stroke, right? Heat stroke is also known as sunstroke, is a severe heat illness that results in body temperature greater than 40 degrees Celsius. Along with red skin, headache, dizziness, confusion, sweating is generally present in exertional heat stroke, but not in classic heat stroke. The start of heat stroke can be sudden or gradual. Heat stroke is a life threatening condition. Oh, we have a viewer in YouTube. That is amazing. The start of heat stroke can be sudden or gradual. By the way, this is an Ask Me Anything About Homeopathy. You can, ask your questions in the chat, and then I'll do my best to answer anything that comes up. And while we're waiting for questions, I'm gonna be talking about heat stroke. Heat stroke is a life-threatening condition due to the potential for multi-organ dysfunction, with typical complications including seizures, kidney failure, etc. Right. So how do you treat heat stroke with homeopathy? That is the question. Basically, guys, if you are a layperson, just some basic advice for you. What you have to do is try one remedy at a time, right? Give one remedy that you think might work. You might not get it right, the first time or even the second time. Give one remedy that you think might work. And if it doesn't work, wait a little, right? Of course, you do have to wait a little. And if it doesn't, it's not working at all, there's no improvement after half an hour or something like that, try another one, okay? That's how you should be doing it. Also, you're giving one remedy at a time, right? Like I said, and make sure the remedies, you are choosing the remedy based on symptoms of the remedy, okay? Not anything else. What do I mean by symptoms? Well, for instance, I'm going to talk about all the remedies you might use for heat stroke. Oh, the viewer, okay. So for instance, belladonna. Guys, I had one viewer, but he left anyway. For example, belladonna could be the remedy might work for a case of heat stroke. But you have to give it based on symptoms which you can find in materia medicas or in so-called materia medicas, which are symptom description books, right? And so, for example, if you want to choose belladonna, you have to look at the patient as a whole, right? It can be sudden explosive anger. So mentally, you get a heat stroke and the person is suddenly explosively angry. In homeopathy, you have to look at everything, right? Mental stuff, emotional stuff, physical stuff, general stuff. It's very complicated, okay, guys? Sorry, right? I'm not gonna dumb it down for you. It's very, very complicated. So, by the way, generally it's not recommended for lay people to treat serious acute disease. But I think, some people are gonna try anyway. and then it's good if you get some good information at least, right? So you look at a patient with heat stroke, he might have anger, right? Emotionally, anger is something that would suggest that he might need belladonna. Okay. Hallucinations. Uh, so if the person, yeah, I think someone with heat stroke might actually progress into hallucinations or psychosis, delirium, right? If you get that, that is also a sign of belladonna. Desire to strike, bite, pull hair, or spit. If you see any of this, it's also a sign of belladonna. That is the mental. Um, we have very severe headaches, right? In belladonna, you get a heat stroke. A lot of people are going to get severe headaches with a heat stroke. If you see that, it's belladonna. Um, Pains begin in the occiput and radiate to the right temple or forehead. Uh, and the person is aggravated by light, noise, jar, motion, sun. So, person wants to stay in a dark room, doesn't want to be bothered. If you hop down on his bed next to him, he's gonna feel much worse. That's what jar means here. Severe pounding, pulsating headache. And of course, I'll give you one more thing about belladonna. Face hot but cold hands and feet. That's one of the most important things. Check the feet and the head. And basically, that's belladonna. So we have a lot of symptoms, but the ones I just listed, you should be looking for the ones that I just listed. Okay. Um, yeah, you can see how we prescribe remedies, right? What kind of information we use. By the way, this is a live stream. This is a live stream of Ask Me Anything About Homeopathy. I don't think many people are going to show up. I don't think many people are going to show up, so that's all right. I'm just going to be talking about heat stroke then. I had one viewer on YouTube, but he left. Anyway, that's all right because this is good for me on YouTube. I'm gonna get a lot more viewers if I if I do a live stream. It's gonna get a lot of views compared to my pre-recorded videos, so that's gonna be great. Yeah. Any other remedies for heat stroke, guys? Any other remedies for heat stroke? Well, of course, we have the good old, the classic remedy for heat stroke, which everybody knows. Which is, 1 second, I'm getting there. Glonoenum, which is of course, made from something, a weird substance. Anyway, so glonoenum. If you want to pronounce it the Latin way, it's glonoenum, right? Basically, if a person with sunstroke seems to be confused as to location, gets lost. Okay, that's a sign of this remedy. General aggravation from the sun, pulsating headaches, just like in belladonna. So if he has pulsating headaches, very bad headaches, it could either be belladonna or glonoinum. Worse from the sun, headaches come and go with the sun. Flushed face, bounding carotids. Better lying in the dark. Yeah, but he's not gonna have heat in the face and cold hands and feet, right? Remember that one? This one doesn't have that. Right. Bursting headaches, right? It's more like a bursting feeling for this remedy. If you want a differential diagnosis between glonoinum and belladonna, instead of starting in the occiput, this is a whole bursting feeling in the whole head. Yeah, sorry guys. Homeopathy is very complicated. Also, everybody knows another good remedy for sunstroke might be I'm just getting there. Natrium carbonicum, everybody knows this. It's one of the biggest remedies for heat stroke, right? Basically, sadness. Okay, this remedy might be more going towards sadness instead of, you remember belladonna, going towards aggression, biting, whatever. Remember that one? So this is going in another direction, going towards sadness, grief, sensitivity. So this is how you can differentiate between remedies, right, guys? So you can already see there are different characteristics. That's how you differentiate. That's how you pick out your remedy. We don't do it randomly. Okay, so homeopathy is basically a science, right? I always say this. And this is the scientific part, right? This is exactly what I've been talking about in all of my videos. This is exactly it. Deciding between remedies, you have to do it based on a scientific process, which is characteristics you can observe from the outside concerning a patient. Belladonna, aggression, natrium carbonicum, more like sadness. Okay, guys? Mental dullness, averse to company, right? Feels better when he's alone. Belladonna, he's aggressive. He's kicking and biting people, whatever. So, headache from the sun. This is, of course, again, going to be prominent in many heat stroke cases. Yeah. Stomach pains. I think he might get stomach problems. That's one thing I think you should be looking out for when you suspect someone might need natrium carbonicum for heat stroke is stomach problems. If the heat stroke also arrives together with some kind of digestive problems, stomach problems, that's probably a sign of natrium carbonicum. Pain at the end of urination. Could be. Could be. Okay, so anything like that. Uh, right. I think that's it. I would say that's it. The things that I listed are going to be uh, good ones to identify natrium carbonicum. By the way, this is a live stream. Again, no viewers. But I did have a viewer, but he's gone now. Anyway, I think that's all right. That's all right. This is a live stream where you can ask me anything about homeopathy. I'm talking to no one, right? Right now. So, but still, you can ask me anything about homeopathy. No worries. Uh, anyway, let's maybe continue for a little bit. Don't know how long I've been going. How long have I been going? Doesn't say anywhere, right? Doesn't really say anywhere. That's great. It doesn't. Wow, YouTube is amazing. Maybe if I refresh on Odyssey, I can see something. Started 21 minutes ago. All right. I'll go for a little bit longer, maybe. So, are there any other remedies we might consider? Yes, there are. By the way, guys, if you didn't know this about homeopathy, any state, any disease state, when you're trying to treat it with homeopathy, the basic theory is that it could be any remedy. So hundreds of remedies. That's theoretically, okay? So that's why it's not recommended for non-professionals to treat even acute disease. But of course, it doesn't hurt, I think, to give out some information about this process. Anyway, any acute disease could be any remedy. So it's going to be very difficult, but we can, like for stuff like heat stroke, we can identify a few remedies which have a high affinity for that. Okay, it is possible. And another one that might come up, okay, is I think gelsemium, right? Gelsemium might come up definitely. Again, let's see, gelsemium. Where are we? Let's just find it here. Yeah. Gelsemium mentals, right? I think cowardice, right? He's gonna be timid, quiet, reserved. Cowardice are the mental characteristics of gelsemium. Um, so you can see it's a little different again. It's a little different again when you're looking at the other heat stroke remedies and this one. So we were looking at belladonna, natrium carbonicum, etc. And now we have this one. It's again a little different, right? How can cowardice come up in a heat stroke? Like, if someone has heat stroke, and I just got another viewer, and he left, and this one left. He left as well. I don't know why. Anyway, you look at the patient, right? You observe his behavior and draw conclusions based on that, which is very difficult. But it resembles more like a person who is afraid a person who is anxious, then it might be that is moving us towards gelsemium as the prescription. Okay, that is how you should be thinking in homeopathy. General, yeah, he's he's frightened, trembling. Okay, so heat stroke with trembling. You know, trembling, like his hands are like this or something like that, or his whole body. Uh, think of gelsemium. Great weakness, fatigue, also gelsemium. Again, you can see the contrast. Belladonna is not going to be fatigued. He's going to be jumping around and biting everybody and hallucinating, right? Generally better from urination. He goes to the bathroom, he feels better. Very bad headache also in gelsemium in the back of the head, which is called the occipital region, right? Also, you look at the patient with heat stroke and eyelids heavy and drooping, diplopia, and thirstlessness. I think those are pretty good symptoms. Those are the symptoms you should be looking for. If you see those, give this remedy. Don't give another one, right? So basically, that's how you treat. Well, no, that's not how you treat heat stroke in homeopathy. These are some of the major remedies that could be used to treat heat stroke if they match, if the symptoms match. Okay, that's how we can talk about them. All right, guys. I'm not getting any viewers, so I'm going to stop here. Basically, I had two viewers. So two viewers popped in and then left after something like a minute. But again, that's an improvement over the last over the last stream, I guess. And yeah, live streams are great because I'll get more views on the replays in YouTube, basically. So thanks everyone for watching. Take care.